review where to find all the equipment that you'll need in the event that you need to place an external ventricular drain at the bedside. You'll need to get the cranial access kit, and I'll review how to prime and get the flushless transducer ready. Sometimes you hand this off to the physician and they'll go ahead and do it on their sterile field, but sometimes you might need to help with that, so I just want you guys to be prepared with that. All right, so here in this blue bin is our cranial access kit that we keep here in the ICU. And I'm gonna take all the equipment out so that you know what all the pieces and parts are to make sure that when you do grab it, you have everything you need. We also have a second cranial access kit that is kept in the OR. When you go to the OR, the double doors will open and it is at the bottom of the carts directly as you walk in. Can go into that part of the OR because the red lines have been moved. So it's okay for you to walk in and just grab the whole bin. Their bin is yellow. Just make sure that the bin gets back to the OR and you have filled out one of these inventory lists, and you need to put a patient sticker on here so they know what to restock and which patient to charge. You should also do the same thing for our cranial access kit and make sure that our AA or whichever you see is on and responsible for ordering supplies gets it so that they know what they need to order so we don't run out. Okay, so now to review the contents in the box. So this large box here is the cranial access kit. It has everything the surgeon needs, including a hand drill, drapes, sterile needles, and things like that he will need to, and it has lidocaine to get access into the skull. Over here you can see this is what will be inside. This would obviously be opened sterilely. You can basically just hand this off to the physician and he can get everything ready for himself. But he's got drapes, pen, povidone iodine for cleansing, gauze, also the drape here. See where that hole is, so we have this access point. After he's already cleaned everything and marked it. Needles for his lidocaine and everything, which the lidocaine comes in this little box. There's also a straight razor in here, but we do keep our electric razor on the charging dock in the med room on top of the antibiotic fridge. And then just make sure you get a clean head, which is usually in the drawer under the counter next to the sink. And then in here, you can see lidocaine. Like there's also sutures in there so you can see everything. And then here is the razor. Hand drill with the drill bit. Scalpel. So in addition to the cranial access kit, so everything we need to get access into the skull, you'll need to hand off, this is the catheter that the physician will insert into the ventricle once he has gained access into the cranial cavity. This box here holds the actual drain itself, the external ventricular drain. That looks like this. You'll need a flushless transducer. We also keep surgical gown, extra sutures, and there's actually even a clipper head in here, but never a bad idea just to grab one just in case. JP bulb drain, sterile saline, sterile preservative-free saline, CHG tegaderms, extra chloroprep, and that should have everything that the physician needs. So now I'd like to review how to prime the flushless transducer. Yes, it sounds funny priming a flushless transducer, but you do have to prime it with sterile preservative-free saline for it to work. The reason it is called a flushless transducer is because unlike our arterial lines, you do not hook up a bag to it, which, would be bad. You don't want to flush anything into the brain. That's why we use a flushless transducer to transduce our ICPs. This has to be done sterilely. So I'm going to demonstrate how you would go about doing that. First off, make sure if you're helping the physician with priming this, you are using sterile preservative-free saline, not this. This is not sterile, so don't go into the nurse servers and grab this and prime your transducer, okay? Only this one. So let's pull this off. So get your sterile gloves on. It's always best if you could have someone hand off your normal saline, sterile preservative-free normal saline. And then you can open and put your dead enders into your sterile area here. These white guys need to be replaced with the yellow dead enders because these have holes in them, so it will not be sterile or close to the atmosphere if you do not remove them and replace them. So attach your sterile preservative-free saline here. It's the only one that will fit if you're ever in a panic because you get kind of excited when we're putting this at the bedside. It will not go here or here, it must go here. So that can help you remember as well because it doesn't fit anywhere else. Flush through. Turn this one back. Turn this one. And flush all the way through here. Turn it off. Place this dead under here. This one goes on the tip here. Notice it's kind of funny looking. It's a little different than the other one. So that one goes there. Make sure they're nice and tight. As I said before, the physician may just want you to drop this onto his sterile field and he can prime it and get this all ready and connect to his drain. It's physician preference, but you can help get their drain set up by doing this sterilely and then attaching it here. This is another good time for you to maybe have an extra set of hands here while you are still sterile and have them remove this red cap here. And then you can always scrub this with a Prevantix if you're worried while taking the cap off if it got soiled or anything of that nature. Attach here. And make sure it is tight. You don't want this falling off. Okay, so just make sure it's nice and tight. So you can use this level that comes with your drain to try to match it up with the tragus. Or you do have this traveling yardstick but some people prefer to try and measure it. Once the transducer is level, you're going to need to close your stopcock so it's already off to the patient here. I usually do a double off to the patient, so I'll also turn this one. Then you want the transducer to talk to the atmospheric pressure. So you turn the stopcock here, which opens the two-way stopcock. You would then very, very aseptically take this off. 0 on your monitor. Well, I don't really have a monitor. You would then 0 on your monitor. And then once you see the 0 and hear the confirmation beep, put that on. If for some reason you were to accidentally touch this or contaminate it in any way, please clean with chlorhexidine. Then you would turn it off. Put this back in the off position to this sampling port. And then you turn the stopcock this way. You should then be transducing an ICP from your patient. To leave it open to drain. And then to clamp off to the patient.